Hey, this is Russ. Time for updates from our knee patients. Yes, it's been a while, but I have two updates for you. Patient 15F from Ohio and patient 16F from South Florida. Both of them actually sent me stuff today. Yes, we are on time this time. So these are current, all right? So let me read you, like I usually do, let me read you what they sent me, okay? So patient 15F from Ohio, she sent us a photo of her recent knee. She actually had the second knee done. Yeah, brave soul. So here's what she says. She says, my restless leg has gotten a whole lot better. I've taken acetaminophen only once in 3 days, all right? She says, my second knee is still stiff doing the stairs, but I'm walking without a cane. I guess I hit my worst time after surgery, then it's been uphill since. Glad you're doing the knee videos. Thought you would cut them down to once a week. Yeah, we're down to 2 times a week with the possibility of maybe 3 if there's things to talk about. And those will be on those bonus days, right? I'll put the schedule up here so you can see that, okay? So she says, it must make you feel good to know that you're helping others with your videos. Great job. Yeah, thank you very much, okay? And here's an update from 16F from South Florida, okay? Here she says, hi, Russ. It's been a while since I last wrote to you, but I'm back to work full-time and definitely busier than I used to be. If you remember, I did my MUA in March of 2021 after the knee replacement in November of 2020. Did a few more weeks of therapy and then I was discharged. I struggled with my flexion for a while, but my knee is now bending at 112 degrees and I still work at home with my bike, but I'm able to do most things like walking without pain from the surgery knee. And like I said earlier, I'm back to work full time. But what's bothering me now is my so-called good knee. I was so-called. I was wondering if anyone had this happen to them, where their good knee is hurting and not the surgery knee. Okay, I kind of had something like that. So here's what I responded back to her. I said, thanks for writing. Patient 15F sent me an update today too. I'll put the question to the viewers to see if anyone responds. Okay, so if you guys have had this happen to you where you felt that your other knee is hurting more than the actual surgery knee, let her know. Okay, put a comment in the comments. I said, for me, I would say that while my left knee, which is the operated knee, is usually still stiff in the morning, it doesn't really hurt like it did before the surgery. But my right knee hurts more, and that's the one that was not operated on. Now for me, I know that the knee also, that knee also has an issue. Okay, my right knee does. But it sounds like you do not know whether your other knee actually has issues, correct? I wonder if it's hurting now because you might be walking a bit differently than you did before, okay? Just to compensate for the operated knee's potential issues of walking since the operation. Who knows? So she wrote back and she said, that's what my doctor said, that I am compensating, but I didn't know what okay, start again. She says, that's what my doctor said, that I'm compensating, but I didn't know that there was an issue with my right one. So exactly, she says, so just wanted to check to see if this is a common occurrence and not an isolated case. I'm really not ready to go at it so soon again, but we'll definitely keep you updated. Yeah, nobody wants to go for that second knee if they can avoid it, okay? And you got brave people like our other patient, okay, from, where was she from? 15F from Ohio. She had both knees done, not at the same time, but right after the first one, she went in again and got a second one, okay? It's always been my feeling that that I would just do it right away. That's what I always thought I would do. I would get the one done, let it recoup, wait a few months, go and get the second one done. But with all the problems I've had with my left knee, I told my doctor we're not doing the right knee, because we had actually planned 3 or 4 months later we would do the right knee, and he had told me at that time I wasn't ready for doing either one of them. So when we were done with the left and all the problems I had, he asked me, are we gonna still do the right one? I go, absolutely no way. And he knew it. I said, we're gonna do that at the last resort, and then we'll come in to do the right knee. So so far for me, I do feel it in the right knee sometimes, and it could be because of compensating. But I do know I had a torn meniscus in that knee as well. I had torn meniscuses in both knees. And so I do know that that knee also has problems because we've done x-rays and stuff. We see it. But it's not at the level where I really have to do anything. So I'm holding off as long as I can. And that's my feeling today after having gone through all this stuff, that you should hold off as long as you can. And then, okay, when you're hurting that bad because you're holding so long, then when you're done, you might be able to actually say that was worth it. Okay, that's the reason I'm not able to actually come out and say it was worth it, because my left knee wasn't so bad that I was like dying from it. Okay, it was bothersome and it was starting to hurt more, but I don't think I was ever at the level of pain that many of you guys have gone through, forcing you to have to go through this operation because trying to get away from the pain. I was never at that level. So people ask me, is it better now than before? And I have to say, no, it was better before. It was before the operation. So everyone has their own level of, saying, was it worth it or if it wasn't worth it. So I don't think I'll ever really be able to get to say that because my knee wasn't hurting that bad. Now, if I wait forever for the right knee and then I have to do it because it's hurting so bad, maybe for that knee I can say, yeah, it was worth it. Anyways, that's what I have for you guys for today. Keep in mind, there's a new schedule that's running. Yeah, it's up here. And if you have things that you would like me to talk about, definitely let me know. You could either send me an email, you can put it in the comments, whatever. Okay, the email contacts are in the Russ is Right channel, so you can't miss it. It's contactrussisright@gmail.com, or simply just put something in the comments and let me know if you would like me to cover it on a video. Okay. Anyways, that's about it. I'll talk to you guys next time.